Meeting resumed. Since we have a new batch of deputations for this session, may I spend some time to remind you of the following. You can make use of the earpiece in front of you. Channel 0 is the floor, Channel 1 Cantonese, Channel 2 English, and Channel 3 Putonghua. May I remind you that you can provide us with written submissions after the meeting, if you so wish. You are not protected by the Electoral Powers and Privileges Ordinance. That means you are liable for your own speech. For security measures, in your invitation letter and also table today is a copy of our security arrangements. If need to be, those in public area can approach our staff for a copy. If there are no further questions, we will continue with our public hearing. First, Mr. Fong Ho Kyu. Thank you, Chairman. I'd like to focus on the resource center for EM. I'd like to ask whether there is a blueprint or comprehensive planning for provision of service to the EM. Since the government is responsible for resource allocation and coordination, it should know very well how resources are allocated to what districts and what services available. So the government is in the best position to plan for services for the EM, for instance, in terms of their cultures and their daily habits and lifestyle. How can they integrate into society, and how many, after a certain number of years, what improvements do you expect in terms of integration of EM? Because these centers are set up to help them to integrate society. You cannot just rely on one or two activities or the Disneyland. Rather, you rely on day-to-day interaction between EMs and the local people. So there should be a concrete blueprint for these service centers so that gradually EMs can be integrated with our community, and the blueprint should also be available to the public. And I hope in the provision of service, these centers can respond to the needs of the EMs. In terms of language, lifestyles, and habits, they are not the same as Chinese people, and the most direct way is to ask service users what their needs are. The government can commission organizations to survey the service users to learn about their expectations, the kind of service they want, and for those that and the reasons for some of them not attending or not using your services, so that you can really understand what they need. For instance, I've got EM friends who've told me that very often interest class and theme park visits are offered by these centers, but these do not help them to integrate with the local community or to expand their life cycle. So they rather save traveling expenses and time to do housework or take care of their kids. So they haven't benefited from these activities. So please do not waste your resources before providing activities and services. You should understand the needs of EMs first. In launching activities for EMs, centers should allow EMs to provide it on a self-help basis. You can cooperate with them so that they can also participate in public affairs and be better integrated with society. Mr. Hong Chiu-Hua from DAB.
Early development of Hong Kong, ethnic minority citizen has contributed to the growth and prosperity. In recent years, we realize that the government has paid a considerable effort in integrating our EM citizens into our society. For example, attempts on language education at school and NGOs, and to assist them for social welfare, public housing and healthcare services, etc. However, our DAB EM Center still received over 70 cases of complaints and requests on public housing in the past 2 years. For example, Management Office of Public Housing Estate post their notice, such as rubbish collection bag scheme and the Chinese New Year activities in Chinese only. Hence, the EM residents have no knowledge about the campaign and activities in the public housing they are living in. Moreover, one of our EM clients has a neighbor that constantly shout abuse to their family. Obviously, the EM family was very much frightened and made a complaint to the management office, somewhat like the Chinese notice problem. The matter was not being seriously handled and left largely unresolved. Currently, the pre-booking of telephone translation services provided in public hospital basically are helpful for EM patients. However, high demand of EM translation services and increased drastically in recent years. Especially the aging EM patient or emergency treatment need on-site interpretation services. In the health care service, such as the Hong Kong Eyes Hospital, it happened to our client 2 weeks ago that queuing announcement was made in Chinese only. Hence of EM patients often missed their consultation section as they do not understand the announcement in Chinese. We urge the Housing and Hospital Authority should look into whether discrimination or negligence were handling problems or complaints made by EMs. Are they be treated in a fair and reasonable manner? And we suggest both Housing Department and Hospital Authority should provide bilingual notice to residents and bilingual announcement system in all public hospitals, as well as to improve the current interpretation services of the major languages being used by the ethnic minority. Thank you.
唔該，洪生，跟住我哋請霍漢橋先生，唔該。
多謝主席。咁
Mr. Wong Yuk-ming, Mr. Fok Han Kyu, many deputations here are EMs as well as Chinese. I am a Chinese. Why am I here this afternoon? Because I can read Chinese. I saw on Electrical website that I could come here, and as a citizen, I do have the right to speak. I have the incentive to speak here because I know that legislators and members of the administration will listen to me. However, according to the census, we have close to 20,000 Pakistani people living in Hong Kong, and according to my Pakistani friends, about half of them, or close to 60% of them, do not know Chinese or English at all. So they've been isolated from the basic system of the government. They are not aware of their rights. They don't know that they can speak out here, and even in their daily difficulties, it's all because of the lack of incentive and also the language barrier. Because of time constraints, I will also talk about the services offered by SSC for EM. Some EM friends have reflected to me, for instance, tutorial classes. They are not very effective. So it's just that tutors help students to complete their homework. Students do not know how to read the questions and understand the classwork.
And if you look at the information provided by the administration to this council, apparently these tuition classes are meant by tutors who are themselves students, and then they would just be providing counseling to Chinese students. And then what if they don't speak Chinese at home? Then how can they provide answers to these students? But then at EM centers, so it's like they are treating Chinese students, and then they would just be providing counseling in Chinese. But then if they simply cannot speak Chinese, then how can they get the assistance? So if we do not provide specific training for these tutors so that they would be able to understand their language, and then they'll be able to help these students to integrate into society, then that leaves a lot to be desired. So it looks like they have many such centers. Well, I understand that there have been tens of thousands of students who might have got this service, but then, well, many people who have been there found that the service is not adequate because, number one, the opening hours are not adequate. They are only open for 3 days a week. And for those who have to go to work, then they simply do not have time. And then by the time they go to the centers, they are already closed. And if they find the courses not useful, then what happens? Thank you. Next, Mr. Wong Yuk Ming. Thank you. Good afternoon, everyone. Well, according to the population survey, well, EMs account for some 6% of the total population, and if you look at the birth rate in Hong Kong, it's over 13%. In other words, for every 7.5 newborns, one is already an ethnic minority group. All right, thank you for sparing the time to look into their rights. But then, in this respect, I hope that this subcommittee can sustain its concern for these EMs. In fact, we have already achieved a consensus in many areas. I don't think I need to repeat that, so I'll be looking at the minor issues. Well, for the new arrivals, well, there is a booklet available at the HAD, and then there is this race relationship group, and between 01 and 07, some 20 meetings were held, some about 2 meetings a year. I don't know if that's adequate, just 2 meetings a year. And also, they've got a publication in 7 languages. Well, it looks nice, but then when I ask some EMs, they are simply not aware of that. Yes, they can download it from the website, but then if they are simply not aware of that, then how can they download it? So can the administration step up publicity, or at least such message should be sent out more widely, or even you may wish to go to their doorstep. All right, before they come, you actually know when they're coming. So you could have sent that out to their homes, or just send them the link. And then amongst the EMs, some 1/3 of them have come from Muslim countries. Well, they have to consume halal food. In other words, there are some 100,000 such families or people who might need to have halal food. So has the administration done anything to help them? Well, is there any labeling requirement for halal food so that you would know that that particular restaurant or that supermarket has such halal food available? So you should seriously look into that. All right, on the mainland, they have many Muslims and they have this particular standard. So you can make reference to their practice. This is the closest neighbor that you can make reference to. So for government-owned premises, like shopping centers and shopping centers operated by the link, and also the housing department or housing authority. So what can be done about it? And thirdly, at a broader level, well, for government institutions and services, can I continue? I'll give you a little more time, so please finish that as soon as possible. Earlier on, many people have already spoken on government institutions interpretation services. I'm not going to repeat that. What I like to see is for you to look into that, and Alice Mack at the earlier meeting also suggested that there should be some data for your information. So please do follow up on that. Thank you. Next, we have Ms. Lau Hoi Ling from Health in Action. Yes, we'd like to follow up on Health in Action. Well, we talked about healthcare services at our last meeting. We mentioned 6 major concerns and corresponding suggestions, and we are pleased to see that both the HA and the government representatives said that they would be prepared to consider it, and a month has elapsed. And I'd like to know the progress. In particular, there are 3 points that we'd like to make. Well, for GOPC, telephone booking system, there should be more quota available. And also for the booking management system, well, there should be interpretation services available, and there should also be special sensitivity to language needs. And as there is no on-site interpretation services, for example, for GOPC and also at the pharmacy, there should be a strengthening of language support. For example, there should be on-site interpreters available. And at the pharmacy, there should be guidelines so that they can also make booking by phone. Also, as mentioned, there is a lack of data regarding ethnic minorities. For example, we don't have this data. We don't have such data available with regard to the health condition of special ethnic groups. And also, if you do not have such data available, then there is simply no way that you can assess whether or not resources are available or suitable. So, and we've already talked about healthcare interpretation services. We don't know if it's adequate. And also, if you look at the studies elsewhere, when compared to comparing EMs and other members of the public, the prevalence rate has been somewhat higher. But then for those of us working at the front line, we understand that for women, their BMI when compared to pregnant women in the population is higher, and therefore we have to collect such data so that we would know that for different groups they might have different needs, and there might have been some gaps, so that we can have more targeted policies to deal with their needs. International, they have already got this awareness. For example, in the UK, in the US, or even in Australia, they've been collecting such ethnicity-specific health data, and therefore I hope that the administration will consider doing this, so that at the point of registration, you should also have this additional item to ask them about their ethnic group, and we should also collect more data from them. And Chairman, I also hope that you can consider extending the term for this particular subcommittee, because we understand that under your plan, there are several areas. For example, for the racial discrimination ordinance review, you still haven't touched on that. I hope that you can extend your term so that you'll be able to look into that. Yes, we'll be discussing that later. Thank you, Ms. Lau. Next, we have Ms. Hong. Translation for her. Well, this is a WhatsApp group to help the EM women to translate day-to-day information. We understand that such service is available, but then it's only confined to English papers. But then in our group, women also need to have information in Chinese translated. Some 415 papers have been translated, and 86 would be school circulars, and also some would be about their homework. And about 150 women are using our services. And if you're talking about some 450,000 people in Hong Kong, then the need would be even greater. So we cannot just rely on the 15 interpreters in our center. We should provide better service in the other support service centers, so that there can be more site translation service available. And if there is a lack of interpreters or translators, then according to our interpreters, they think that there is no such course available in tertiary institutions. Even for those who are proficient, they would not be joining the profession, because the government would only be hiring part-time interpreters or translators, and there is no system to recognize their professionalism, and therefore we should offer such translation courses. We should also have a uniform qualification recognition mechanism, so that more people can be encouraged to join the profession. And also between the service centers and these people, there are a lot of communication gaps, because they don't know that after the interpreter has arrived, they will have to sign certain documents, and after their arrival, they might find that their clients do not need the service, and as a result of that, they've noticed that the doctors and nurses are rather impatient with the EMs, and therefore we urge the administration to publicize the guideline for interpreters, so that we'll be able to monitor the service. And in the UK and Australia and Canada, well, the Department of Health and also the relevant authorities would have to have a flow chart on the interpretation services. They will have to identify the service need, so that the EMs would also need where they can go to for complaints, and then they would understand their rights better. And also in the public housing application forms, it's only in Chinese, and the HD would only be highlighting the information. They would only be translating the summary, and that's tantamount to depriving the rights of the EMs in obtaining information, and therefore they should try to provide the updated information and also the complete information. And also, they can also fill in the forms in Chinese or English. We understand that for some EMs, because they don't understand both Chinese and English, they do not understand the procedures. And in 2016, according to the written reply, because this involves personal data, it's not appropriate for them to try and help them fill out the form. We believe that the staff of the centers can also sign a particular form, and then they can also help the applicants to fill in those forms, so that these can be made more regularized, and then the EMs will also have equal access to the information. Thank you. Sam Eckers, please.
Thank you for inviting us today and listening to our views patiently. Although this committee is focused on ethnic minorities, but my observations are general, applicable to all members of society. Regarding housing, it is a well-known fact that Hong Kong's population has a growth rate of less than 1%. Despite that, there are no direct incentives to provide families and to provide them support to the families who have more children. I suggest that government consider providing direct incentive to those who go for larger families, as middle-class families are often found to be struggling with finances, quality education, housing and other support. The only direct benefit parents with children receive are in form of tax deductions, which basically means that if you are earning well, you get the benefit, but if you are not earning well, you are on your own. The housing department should also consider providing out-of-turn housing to those families who have 2 or more children. Regarding the hospitals, anyone who has used hospital outpatient department and general clinic would observe that they are basically just dispensing factories of Panadol, painkillers and cough syrups. There is an extremely long waiting time at hospitals for specialists, and as a direct result of the failure to attract overseas talents and to utilize the locally available talents. Recently I came across an ethnic minority lady who migrated to Hong Kong from UK. She happens to be a qualified physiotherapist from UK, but she failed to secure a job in her relevant profession in Hong Kong because her degree was supposedly not recognized locally. She had to make a career change and took up teaching English instead. The skills and education of such migrants are being wasted because of lack of appropriate policies on this issue. When it comes to ethnic minority center, ethnic minorities usually approach these centers just to find out when is the next Disneyland trip. These centers do not have any focus or aim, and they also do not have any procedure to keep the members updated on what is the latest that they are providing. A member has to visit the center or call them to keep asking on what new courses or activities are available. Ethnic minority centers should focus on providing some real training and skill development, including a regular Chinese language course. They should also join hands with the government organizations like Innovation and Technology Fund, Brand Development Council, Continuing Education Fund to provide skill development and provide courses which target especially towards ethnic minorities. Thank you.
Thank you, Mr. Egger. We now invite Ms. Shazia Ali of the Women's International Guild, please.
Good afternoon, Mr. Chairman and members. Thanks for giving us the opportunity to come here and raise our voice. And today we are here for 3 basic issues, but right now I want to highlight the issue of halal food, as we are Muslims and it is very hard for us. So please, whenever you have opportunity to consider this problem, please help us to do that. And in the health, the most important issue is the language. As you know, the ladies of our community, they are not very much well educated, so they must need someone from the home, either the husband or the friend or the children, to accompany with them to hospitals to see a doctor. So if any of them are not available on that time, so she have to stay at home. So they are suffering. And the most important thing in my personal experiences, because my organization is mostly working with the ladies, the old ladies who are above 40 or 50 or 60, they feel very uncomfortable in hospitals because they don't understand English and Chinese. And whenever they want to talk with the nurses or with the helpers, they have to say, hello, hello, come here, and they don't listen to them. So sometimes they ask them to, we want to call our family, please help us, and they say, no, we cannot allow you to talk with your family on the mobile or something like that. So they feel more depressive. They are sick, and in that environment, they become more depressive. So hospital have to be a good environment where the patient feels safe and satisfied. But in that mental pressure that you cannot say what sort of pain you have, maybe you have some nerve pain, or maybe you have some sort of emotional problem, but you cannot say anything to anyone there. So my recommendation or my suggestion to the members here is that we must have an interpreter on duty, same like the security guards as we have in the hospitals. I think they are most important persons than the security guards. Then we must have an interpreter there on the emergencies also. For example, if anyone can speak English very well, but maybe at that stage of emergency, he is not in that mind. So how can he say what problem or what she have the problem? So these are the main issues which we have to raise in the health. And secondly, we have the problems with the dress code. Some of the ladies, they don't want to wear that sort of dress in the hospitals. So please allow them to wear their own or some other arrangements. And the sizes for the male and female, the sizes are also not so very well for us. So it's somehow people don't want to wear that sort of dresses. So my main target is the housing also, but housing for the newly arrived in Hong Kong people, it is very, very hard to survive. One minute, please.
Go ahead, please. Go
because
ahead.
The government is supporting the people who are living in Hong Kong for more than 7 years by the CSSA, by the other means, but the people who just arrived to Hong Kong. I personally visit many families who just earn 10 to 12,000 a month, and they have to pay 7 to 8,000 a month as a house rent and electricity. So it's hard for them to survive. Thank you very much.
Thank you, Ms. Ali. We now invite Ms. Rizwana Latif of the EMNTK Housing Concern Group, please.
We are ethnic minorities living in Hong Kong. We usually have more than 4 household members. We encounter various difficulties upon housing issues. The following are our main concerns. Monthly household income of ethnic minority is lower than poverty line. We spend half our income on rent. Most of the ethnic minority families have one breadwinners, and they have mostly 2 jobs to sustain their daily needs. So we would like to request government to review the tenancy ordinance, keep the rent within limits and reasonable price. Most of the ethnic minorities families have more than 4 household members. Firstly, when we face eviction in 1 month termination period, it is hard for us to find a new flat immediately. We also need to consider the school of children, school networks, and job arrangement. This is more likely a family crisis for us. Secondly, it costs also extra money to move one place to another place. Also, we have household materials, for example, furniture and other household things, which takes a lot of time, and also most of the old buildings do not have elevator facilities. So we would like to request the government to review the tenancy period to extend the termination periods of evictions by both sides. Moreover, ethnic minorities also face language barrier, especially in housing issues. We do not have easy access for the information in property agents, as most of them provide the Chinese version only, and we ethnic minorities face difficulties. We would like to request the support service center for ethnic minorities to provide some community education services, for example, culture sensitivity training to the property agents, or implement interpretation services in estate agencies. Property agencies do not give us a private rental flat, and they discriminate with us. The estate agents authority to do more cooperate with supporting center for ethnic minorities or non-government organizations to provide culture sensitivity training for estate agency to be better familiar regarding ethnic minorities' cultures and background. Thank you.
Thank you, Ms. Latif. We will now invite Dr. Dira Garung of the Health Connection Group, please. Thanks.
Good afternoon, Chairman, members, and everyone here. Today I'm here not only as an ethnic minority, but also as a public healthcare professional, and as well as from the side from medical translation and interpretation. I would like to tell you that I'm not only worried about ethnic minorities, but also I'm worried about the health burden of Hong Kong as a whole. The reason is that health is a very important aspect for our city, not as only for the ethnic minority. But what I see is that we have a huge gap in health promotion here, especially when you look at ethnic minorities. What we see is that the media, as well as there are other channels that has not been utilized properly in terms of the dissemination of health information and health promotion. We have Center for Health Protection, but then the information that is provided in Center for Health Protection's website, wow, we have a problem with the language there. It's very sad to see that the language that is provided in CSP website, most of the language in what we can see there, either it's very academic to be understood by the layman, or is simply as a machine translation. It's just you input everything in Google and you come out with this translation, and I don't know who is there to check it out, but it's kind of published on the website. And it's very sad to read that is not readable at all. And the second thing that I also like to put out is about the information about the cultural sensitivity training. Now, as a health connection, what we are trying to do here is that we are not only trying to connect this language gap, we are also trying to connect the culture gap between the healthcare providers and the ethnic minority people in the community. What we see is that because of the lack of cultural sensitivity and cultural competency, there's a huge problem, not only for the in terms of eating and wearing, but also in terms of other cases, for example, in terms of mental health and psychiatric counseling. Likewise, when we talk about medical interpretation, yes, what we see is that we do need interpreters, but do we have competent medical interpreters? Do we have proper trainings for them? But also at the same time, what I would like to focus on is that we need to train our healthcare professionals about the roles of interpreters. We are not here only to connect the language. We are also here to maintain and tell them about this is the culture, and then we need to be the cultural broker. So interpreters are supposed to be linguistically as well as culturally competent, but what we see is that the healthcare professionals are not aware of that. Last but not the least, what I see is that we have so many ethnic minorities who are interested in health services. We have also so many people who have this kind of background from healthcare services. But having said that, when they come here in Hong Kong or when they grow up here in Hong Kong, they end up doing some other jobs that is not related with their profession. So I would like to say how we can help these people and how we can work towards making not only healthy ethnic minority but healthy Hong Kong in future. Thank you.
Thank you, Dr. Garung. 跟住就請陳鴻輝先生，唔該。
係多謝主席。
Mr. Chen Ho-Fai, I am a social work student. I am on practicum now, so I have the opportunity to come across EMs, and I've done a survey on housing. So I like to talk about housing for EMs. Well, in the private market, when EMs want to lease private accommodation, over half of the respondents said that they were in private accommodation, although their income was not that high. So what are the reasons? Over 70% of them felt that they had difficulties in communication, and 60% of them felt being rejected because of cultural reasons. For instance, as far as they know, their cooking might carry certain flavor, or perhaps they might use aroma, and landlords tend to refuse to lease their premises to them, and some have been felt that they were rather dirty, and some didn't even know the reasons for that rejection. We might have guidelines for our real estate agents that such clients be served, but is it true that we cannot reduce the amount of discrimination they face? And sometimes tenancy agreements are only in Chinese. How can you expect EM tenants to understand the agreements? So can the government just ask the market to look after itself? And as for public housing, I'm pleased to see that gradually we're providing interpretation service to PRH applicants. However, for a sitting tenant, do the staff at estate management office know of such services? I've called a dozen or so PRH management offices, and they did not know that there were such services available. And according to a paper, you have a pilot scheme in Tianyuan estate, but I believe there should be more than one PRH estate with EM residents. Most of them had to wait for 5 to 5.8 years before they could be given an offer, and some of them had to live in 2 flats. Why can't you build bigger flats to accommodate larger families, not just for EM families? I think even locally there are big families as well. So there should be clear and open guidelines for arrangement of interpretation service for frontline staff to follow, and how their needs should be assessed to ascertain whether they need interpretation service. And you should also follow up with frontline staff to see how the service is used, and they should be made more sensitive of the cultures of EMs. Ms. Choi Siman, deputations have talked about the constraints EMs face. I'd like to talk about the matter of genders. Many EM women have difficulties going out of their homes. Some of the women have been forbidden to leave home, even to visit the shops their husbands operate. So it's not easy for them to go to a hospital or a clinic for help. They have to be accompanied by their children or people who know English to reflect their medical problems. And in fact, professional interpreters are needed, because we need systematic training before we can have interpreters competent to do such translation. And many EM women told me that they would like to visit a female doctor, and they had to travel to another district, and therefore traveling expenses are higher. Given the higher medical costs, can we give medical vouchers to low-income families among EMs? And according to the paper, there are some cultural sensitivity training for frontline staff. Can we include gender mainstreaming training? Because some EM women find it difficult to be approached by a doctor of the opposite sex. And special training in languages should be given to doctors. They need training in interpretation, but for this website, there are only 2 languages available, in Chinese and English. Publicity should be enhanced, and languages of EMs should also be provided. Many deputations want this subcommittee to continue its operation, because a number of issues are covered in today's meeting, and we don't really have enough time. And when we promoted this public hearing to EMs, many of them would want to attend, but they could not make it today, and information is also limited. I urge the chairman to continue the operation of this subcommittee and to make it a standing establishment. We have representatives from the HA present, and we would like to have responses from the HA on comments raised on policies. And for interpretation services, we hope we can hear from the HAD, and also from the HA, we'd like to see how support services can be improved. Thank you.
Tareem Yunus, please.
Thank you, Mr. Chairman, for providing this opportunity to bring to your attention the problem faced by the ethnic minority in Hong Kong. I would like to speak on behalf of few EM families who are Hong Kong residents for a long time, yet have faced troubles in gaining access to housing facilities in the city. One case mentions that they had to wait for 2 months and went to as many as 37 agencies to search for private rental housing. The situation is not only bad in the populous areas of the city, but the other families face similar situation, that is waiting for 6 months even in the new territories. The following points were observed with regards to the estate agents and landlords' behavior that are cause of concern for the EM and certainly a breach of the Anti-Discrimination Ordinance. According to the 2016 study of the Equal Opportunities Commission, some Chinese property owners did not want to lease their properties to EM, fearing either lack in proper communication, delayed payments, or possible disturbance to the neighbors. Some personal experience also indicate that the concerns of landlord regarding an inadequate maintenance of the house cooking styles, particularly the smell of curry. Few landlords even went as far as forbidding the tenants from using the kitchen for cooking, which is surely quite inconvenient. Even in the case of landlord agreeing to rent his property, extreme documentation was required, for example, information about the whole family background, income proof, employment record, number of permanent and non-permanent members in the family, etc. Moreover, after a successful agreement, landlords would even spot check the premises, causing a great hassle for the residing tenants. As far as the attitude of the state agents is concerned, in multiple cases, poorly maintained houses with low ventilation were shown to the EM tenants. Some of them completely refused to entertain the tenants unless there was a Chinese guarantor with the prospective tenants. Despite their clear instruction of the equal opportunities in rental services, agents seem to be ignoring it. The last issue that is a cause of concern is the high rents. Research conducted by the Diocesan Pastoral Center for Workers to 2014 has shown that almost half of the EM live in private flats, with paying more than 5,000 per month for a flat less than 300 square feet. An average two-bedroom flat in Shamshirpur area has 12,000 monthly rent. For a family with income of only 15,000 Hong Kong dollars, even with subsidy, it is a problem to afford such housing. And similar is the case for PRH. A family has been waiting for 7 years despite their eligibility, and not a single chance has been given to them up till now. Despite giving the medical certificates for their wheelchair-bound elderly, they haven't been offered any house. In the end, I would like to say that there may have been problems caused by the EM families, but few black sheep do not correspond to the whole group. Whereas there can be measures taken to cater the reservation of the landlords, this type of stereotyping should be ended through training and public education. Thank you.
Thank you, Mr. Jonas. 跟住我哋有請仁愛堂社區中心。
Next, from Yan Hoi Tong, Mr. Ma. Thank you, Chairman. Well, we are from a community center, so we are a district-based service center. So I'd like to share with you some of our views at the district level. And one of the things that I'd like to share with you is that, well, since 2007, we've been providing services to EMs. And in recent years, if you look at the government's resources in EMs, there are more and more. And of course, we have also benefited from that because we've used both those resources in providing services. But then over the time, we've been asking this question: how much do we have to do? So in terms of resource use, well, how can we make the best use of such resources? And the administration has been talking about integration of EMs into a community. But then what does that mean? That's why, as many EMs have said, well, is it that the administration should set up guidelines or even indicators so that we know whether or not we have achieved that target? So when we talk to the bureau or even the department, they might say that just wait. All right, at a certain level, we have already been doing a good job. All right, for some students, well, if they are diligent, then does that mean that they will be able to go into universities? No. So you have to have certain outcome before you can go into universities. So it's like the support service centers for EMs. All right, we've spent so much money every year, but then what do we need to do before we can really help them? That's point number one. And number two, well, very often when you look at the papers, when it comes to EMs, they have to do with the HAD. So we have this thought. So can the HAD be more proactive in extending the assistance to the EM? Well, at the district level, all right, there has been this forum and they have regular meetings. But then on the website, I learned that, well, the last meeting was held early last year. And since then, there was no meeting whatsoever. But then it often involves NGOs and very often the supported units of the SWD. And also many of the services are also provided through the SWD, and often a time that would also involve education. And at the district level, if the HAD can do more coordination, that would also be good. And also at the support service center, we can understand that they are also encountering this difficulty because they can only offer 2-year contracts to their staff, and it would be difficult for them to retain staff. And just like open tendering, so they are also facing high rents. For example, we understand that there is a center because they are not having enough money for the rental, and therefore they will have to downsize the center, and they will also have to segregate the centers and split it into 2 before they can afford to pay the rent. And there are also some stories that would have to be told by the clients. And in fact, half of today's speakers are the EMs themselves. So for the bureaus and the directors, well, they might just tell us their policies, but then what about the frontline staff? So only the EMs can share their stories with you. Thank you.
Wrong, please.
Thank you, Chairperson. I'm going to focus on health service. The United Christian Nether Soul Community Health Service has the mission of promoting health of the community, including dedicated health service for the ethnic minorities since 2007. From the past 10 years of frontline experience, we have identified there is a health gap among the ethnic minorities, making them vulnerable to ill health. In the 2015-16 alone, we had a total of 50 health campaigns in the community, screening 12,640 times. We provided screening for high blood pressure, diabetes, and obesity for adults. Of those screening for high blood pressure, 44% men and then 22% women had high blood pressure. Of those screened for diabetes, 5.2% men and 4.3% women had high blood sugar. Of those screening for obesity, 67% of men and 80% of women were obese. Though UC and United Christian Nether Soul Community Health Service actively involved in promoting health of the ethnic minorities in Hong Kong, we are concerned that there are still many falling through the safety net of healthcare due to language, culture, and social factors, which is form of health inequity. Therefore, we urge the government and the Legislative Council to implement the following measures. Provide more health promotion services at the community level. The promotion elements should consider the language and cultural elements acceptable for the target group. Evidence has proved that culturally appropriate multilingual health promotion intervention are the only mean to reach hard-to-reach vulnerable group in the community, and designate more resources and service measure which tackle on decreasing risks of chronic diseases, as we have observed that they are in high risks of developing chronic diseases in long term. Increase designated health education and training service for ethnic minority women, because we have observed that many of them do take care of their family health, but they are unaware of the impact of diet, physical activities, importance of taking preventive and early detection measures for healthy lifestyle, and increase school-based health services and places where significant number of people are for ethnic minorities. Devise comprehensive child health and care policies which include ethnic minority children, because according to our experience in promoting health safety, we have observed need for education on home safety and child care at households with children and special needs children. The scarcity of services catering the ethnic minority elderly. This group of population are the vulnerable of the vulnerable group, and they need health services. And we also urge to ensure all the health promotion and education messages are bilingual, at least Chinese and English. We also urge for multilingual public health promotions such as government vaccination, elderly healthcare vouchers, colorectal cancer screening, and cervical cancer. Just a few seconds. In addition, health warnings such as travel health warning, flu season warning to accommodate major ethnic minority groups. We hope the government will put forward long-term and comprehensive health policies plan which include the health need and integrate the Hong Kong's ethnic minorities population into mainstream health service. Thank you.
Thank you, Ms. Gurong. 跟住我哋請民主黨朱子樂。
Next, Mr. Chu Chi-lok from the Democratic Party. Yes, my surname is Chu from the Democratic Party. I'd like to give the following views on this. First, on healthcare services, well, many EMs are facing a lot of difficulties. At present, if you look at the safety net services, well, just now we've been looking at the services and also some of the problems. In fact, in terms of interpretation service, it's only confined to the consultation time, so it's only available when they see the doctor, but then when they get the medication, there would not be any such service available. And as a result of that, very often they don't know how they should take the medication, and they might be mistaking the drugs and so on. And therefore, the interpretation service should be extended so that they can also cover other areas. And there was also a case showing that EM patient, after being hospitalized for a month, they have not been told what their illness is. And therefore, there should be more proactive assistance so that they would be able to get timely and adequate information, including ethnic minority groups. They should also understand that in terms of healthcare services, what improvement can be made in order to improve the support for them. And also in terms of housing, well, according to many surveys, many tenants would also have fewer choices when compared to their local counterparts. That's because of the habitual discrimination. And very often for ethnic minority groups, there is cultural difference and also communication gaps. And as a result, many landlords would refuse to rent their premises to EMs. And therefore, we suggest that at EM communities, there should be interpretation centers, and there should be more resources given so that they can hire more interpreters, so that for landlords and tenants, these interpreters can work between them, and they can also translate the tenancy documents for the tenants so as to increase the incentive for the landlords to rent their premises to EMs, and that would also help reduce the difficulties so as to give them more choices. Last but not least, in the support service centers, at present, if you look at the support service centers, there are only 6, is far from adequate. And also, out of those 6 centers, only 1 would provide telephone interpretation service to help them use public services. We hope that afterwards we can extend that to more centers so that there can be more telephone interpretation service. And we also understand that for those living below the poverty line, well, because they don't understand Chinese and English, they are not able to fill in the forms. So it's not just for public rental housing. Many poverty alleviation measures and forms cannot be filled by them because they don't understand the language. And for some of the EMs, when they go to the support service centers, there is also no help for them to fill out those forms, and in the end, they would not be able to apply for such welfare services. We hope that the staff at these centers can help these clients in filling out forms. Other speakers have already said that we hope that we can step up the service so that there can be more flexibility because there have been personal data concern. We hope that the staff can help them so that they can have access to these services. Thank you.
Please.
Thank you, Chairman. Good afternoon. I'm Nibra, Secondary 4 student of Dahlia Memorial School, Broadway, and I'm very grateful for this opportunity. Firstly, I would like to talk about the difficulties faced by ethnic minorities regarding healthcare. Due to the language barrier between ethnic minorities and the Chinese people, ethnic minorities tend to ask their relatives for opinions on how to cure a particular disease. The ill ones might even receive the wrong treatment according to their relatives, and therefore their health is undermined. Regardless of having posters put up in hospital lobbies and public areas, it is still not enough to educate the ethnic minorities. The posters put up are usually in Chinese, which makes the ethnic minorities hard to understand the message behind the posters. Some posters even contain graphic design for educating illiterate readers, but the graphic posters still fail to show a clear message to the readers. For example, a poster aiming at showing the ways to prevent Zika virus may show a mosquito, but how does an illiterate ethnic minority understand the meaning behind and what the poster is trying to say? Now, you may say that there is translated information online, but is the information online really understandable? That's a question to be concerned about. Wordings published online might be too hard to be understood. I think that the publishers should make sure the wordings are understandable and feasible enough to fulfill their aim, which is to educate the public. Secondly, I would like to talk about the services provided by support centers. From my observation, I have realized that many ethnic minorities tend to go to these centers just to become a member and be able to go to different places, including theme parks, without paying a penny. This attitude is not right. The aim of these support centers, which is to educate people, is fading away. There is nothing wrong in providing leisure activities to them, but what's even better is to make timetable, or you can call it a deal. For example, the support centers should organize public education workshops. For example, workshops where ethnic minorities learn about Hong Kong's culture. These workshops should aim at helping the ethnic minorities to integrate to Hong Kong society. And in order to go to different places, the ethnic minorities should first attend these workshops. This way, they can learn, they can gain knowledge and have fun at the same time. Accommodation is another problem faced by ethnic minorities. With a high population density and a limited supply of properties, average rents in Hong Kong have long been more expensive than on any other high-profile cities. This problem is also faced by the Chinese residents in Hong Kong, but what's different is that ethnic minorities also face the problem of in-work poverty. Studies found that many South Asian families in Hong Kong only have one family member working, which is usually the father. The father is usually the only one who's working for the whole family. Some fathers even take up 2 jobs in order to satisfy their whole family's basic necessities. Long hours of work by these fathers is very common. Some families refuse to apply for the comprehensive social security assistance in fear of having low self-esteem, and some families don't even know about it. Thank you.
Thank you, Ms. Jonas. Next, we have Ms. Ekwa Kunwal, please. Ms. Kunwal.
Thank you, Chairperson. Good afternoon, everyone. I'm Ikra from Delhi Memorial School, Broadway, currently a secondary 4 student. I'm here to discuss the high rising concern about housing, service support centers, and health we ethnic face here in Hong Kong. First of all, I will talk about health. Mental health of children is one of the high rising concerns can be considered. Children with mental health inhibitions such as learning disabilities and behavioral disorders. These children require special attention, such as they need easier access to the resources they need to use. In order to tackle these problems, there should be more emphasis on mental health on children, as it's indeed very critical in their formative years to develop mentality which is healthy and positive. However, with obstacles they may face in the future. It should be encouraged that more resources should be allocated to psychological and mental care departments in hospitals, as often there is a lack of manpower in these departments. For instance, a more comprehensive and empathetic team of expertise handling these cases should be developed. Moreover, it can be identified that students from different cultures are surrounded by mental and psychological stress. It can be encouraged that different counseling services offer a variety of language which students find it better to talk to. The other problem is medical descriptions. Medical descriptions should be simplified so that ethnic minorities can have much better understanding, as the description is usually written in a medical term, words which might be very complicated to understand. Moreover, some of the people are unfortunately illiterate. There should be use of graphical image to show how the medication can be used, provided to the illiterates. As a result, they can know the proper use of the medication dosage, etc. The next problem is I want to talk about housing. The high rising problem of discrimination is that the property agent do not consider renting anything to the ethnic minorities by simply stating that there is not sufficient resources to accommodate their need, while there are a number of posters outside their own shop that houses are for sale. They have this stereotypes that EMs won't pay the rent on time, or they will make the flats dirty or create any sort of hesitancy or disturbance that it might affect their business. The Equal Opportunity Commission should intensively monitor the property agencies by doing direct investigation, which fully focuses on any sorts of corruption, such as looking at any corruption or discrimination toward individual or family. Moreover, and give penalty to those who breach the law and ordinance. The wrongdoers should be prosecuted for betterment for the future, such as imprisonment or giving fine. Considering the student and teacher ratio in the tutorial classes provided by the centers are too low, it can be seen that the majority is with the students, which leads the teacher to give answers directly without explanation. When the time is not sufficient, the quality of homework done by the student might not be the best they could have been doing, while private tutors are way too expensive in comparing to the normal ones. The education provided in school cannot be replaced in a short time in tutorial classes, as the syllabus is covering a large portion, but in tutorial the time is limited and the number may hinder the quality of effective learning of an individual. Thank you.
Thank you, Ms. Kung. 最後我哋有請
Lastly, we have Miss Chapman Bow. Thank you. We have a few things to say. First, on the support service center for EM, and second, its role in the housing of EM, and three, the development of these services. If you ask NGOs, you'll know that EM parents are frequently asking for tutorial services for their children. If the answer is yes, they will ask for how many evenings each week, because their children cannot understand properly at schools and there is no one to help them in their Chinese learning at home. Well, in the long term, we have to see whether school curriculum is appropriate or not. NGOs, frontline workers can understand whether the language standards are right for young children. Given that Putonghua is used to teach Chinese, will this cause problems on the part of young children in communicating with local Cantonese? And therefore, HAD should not just look at the amounts of services provided. Rather, observations made at the provision of services can be used for reviewing their services. And HAD started to set up support service centers because back then there were no NGOs. Now, EMs are living in different parts of Hong Kong. 6 centers cannot cater for all EMs territory-wide. In the long term, the direction is not to increase the number of such centers. Rather, we should consider mainstreaming services for EMs. HAD should make use of experience to coordinate the transitional period to see whether all other centers can serve EMs as well. And the second problem is housing. Now, EMs are complained of real estate agents not helping them to rent premises. In fact, just 2 years ago, there were already undercover operations to see how discriminatory some real estate agents were. UOC has done nothing to improve this. They can take the initiative to carry out direct investigation to bring real changes, which we don't see now. And thirdly, development of this subcommittee. We are pleased that there is a platform in this council to allow EMs to come out and tell you their views. Well, the issues are very complicated. In the first 2 meetings, we talked about education, although the agenda item was called implementation of the Chinese framework. But we touched on KG education, the choice of schools, so on and so forth. There are still issues that can be further developed. We should not waste our discussion in the past year. So we'd like to see whether the SC can continue its operation. Thank you. Any response from the administration, please? Any response? I have not. We have about 20 minutes or so left for members to ask questions. I saw a few hands already. 4 minutes each, okay? Dr. Fernando Zhang. Thank you, Chairman. And I thank the deputations who've come to us this afternoon in both sessions to express to us their views on problems faced by EMs in housing, healthcare, and healthcare matters. A lady hurt her foot just now, and she was sent to the A&E department of QEH, and she asked for interpretation service at the A&E department, and I understand that she had to wait for 4 to 5 hours before interpretation service could be made available. So this shows you how important interpretation service is to EMs. At the last meeting, I mentioned recommendations by Health in Action. Their view is that it's very difficult to to book interpretation service by the telephone hotline, and when there is an emergency, you may not be able to offer interpretation at once. But for places where the Yam population is high, such as Yunnan, Yaochimong, and Tongcheng, can there be attending or on-site interpreters to help inpatients, urgent cases, and telephone inquiries? And for prescription and also dispensing services, I talked about them last time. Now I will just focus on healthcare. I hope I will have time to follow on other aspects. Can the administration respond to these comments first? Yes, which one from the administration? Mr. Lee? Thank you. Let me first talk about interpretation service. At the last meeting, some members asked whether the service of contract interpreters can be cluster-based. We've discussed with our contractor, and the current arrangement is demand-based, and it's also based on the address of the interpreters and the usual places he visits. And so the allocation is already cluster-based. And of course, clusters also supplement one another. If there are available interpreters in another cluster, they can be drafted to help another cluster where the demand is high. We will keep an eye on the demand for interpreters, and we'll see how the number of interpreters can be increased. Thank you, Mr. Lee from the HA. We have also Dr. Zheng from the HA. Thank you. After the last meeting, we reviewed our system, and we have found areas where we can improve. Usually, patients have to initiate a request, or if we identify the need, then we'll make a note and provide interpretation service. In fact, we have a system. We should allow a choice of language for patients so that all service stations will be made aware of the need to help patients. Well, I gave them enough time to answer my questions, but they sidetracked. For instance, can there be other languages available in the telephone system? Well, it's just a voice recording service. It's not really meant by a real person, right? And I asked whether there can be a resident interpreter at certain hospitals, and also the names of medication dispensed out. All right, we'll come back to you if we have time. Dr. Helena Wong. Thank you, Chairman. I'd like to know whether you have gender sensitivity and also ethnic sensitivity, and what is your policy in this regard? Some deputations mentioned mental health. Recently, there was a report on a study on mental health. We're going to arrange a public hearing soon. But you've only introduced an age sensitivity factor in your report. In the report, there is no breakdown on gender, not to mention race. So perhaps it's because we do not have any breakdown on the two genders and also races. As a result, there are many hidden health issues in the community unnoticed. Will the HA and the DH consider including breakdown by gender and also race in your report. For instance, the BMI of EM ladies are 3 times that of their Chinese counterpart. That was shocking. How come we've never learned about this in statistics by the government? So can such information be included in your reports, please?
Dr. Zhang or Ms. Leung? Yes, Dr. Zhang. Well, Dr. Mack might wish to supplement on health promotion and so on. Well, just now for BMI high women, well, we have to do more public education so that they have a better awareness, so that they can take care of themselves instead of waiting until the time when they are sick. And also for gender sensitivity, yes, we do note the genders, and therefore we would attach importance to that. But then when it comes to ethnic sensitivity, we will try to see what other countries have been doing. For example, in the UK, 98% of their citizens have been registered with primary care doctors. That's why the data would be more comprehensive, and by the time when they go to the hospitals, their ID data would also be recorded. So we'll see if we can do a bit more. So we'll see how we do the classification. For example, which ethnic groups would be more important to us. So we will have to liaise with different policy bureaus, and if that's the policy, then at the front line, if there is a coordinated approach, then that would be easier. Or else we can only make the decision on a clinical basis. For example, we will record the data on a case-by-case basis, but then we won't be able to achieve the objective that you've set out just now. Well, Chairman, actually, when it comes to gender, well, we have gender mainstreaming, and that's been the long-standing approach adopted by the administration. Of course, when you read the ID card, you would of course know the gender. But then for such analysis and also research report and also such statistics, when the HA or the D of H collate the information, if you do not have the information available, then the academic simply would not be able to tell. And then for the stakeholders, if they do not have access to such information, then that would not help. So what I was asking was, we are not asking for the aggregate data. We are asking for gender or EM specific presentation or data. I don't think that would be very difficult to obtain or to collate. And if you're not able to give an answer today, then can you go back and talk to the relevant authorities so that we can have sufficient data to make policies and also to enhance service quality in order to deal with or take care of different genders and also different ethnic groups? Okay, can you consider that? Because according to your paper, you have never collected such data from ethnic minority groups other than the ID data. So we have not done that systematically. So can you consider that? Yes, we'll see what classification do we have. Okay. Next, Alice Mack. Chairman, first of all, I'd like to thank the representatives for coming. I'd like to respond to what they just said. Well, during the earlier session and during this session, some speakers have asked if this subcommittee can extend its term because there are many areas that we have not covered. Well, of course, if that's possible, I'd also like to see it extended because we'd also like to cover some of the items. In particular, for women in ethnic minority groups, they have encountered many difficulties and problems, and we haven't really touched on that. And many EM women, well, they have difficulties both in terms of their daily life and also in health. We also have to deal with them. And this is something that I'd like to put to the administration. It's not just the hospital authority. Different policy bureaus or departments have not been collecting data from EMs because they are concerned that they might be accused of being discriminatory against the different ethnic groups, or they might be labeled. In fact, it would be hard to make any assessment because if you look at the HA figures, every year we have tens of thousands of interpretation sessions, but then we don't know how many patients there are. what if there are 100,000, and if they go to seek consultation, and if you're only providing tens of thousands of that, is still on the low side. Or else, if you're able to provide them on each and every occasion, then of course we will know that you've been doing a good job. So I think it should be the HA which should be liaising with different policy bureaus or departments, so that there should be discussion on how they should deal with EM data. At present, we simply don't have the data. I think whether it's the housing department or the SW, they don't have the data. All right, they claim that they cannot label them. That's why they cannot collect such data. So can the Secretariat inform them? Or if possible, if we are able to extend the term of the SC, then we might invite the administration to come and tell us how they can implement measures that would fulfill the requirement of the International Convention. Well, of course, we can also discuss with the CMD Bureau. But then for primary care, we also need data. But just now, we know that we don't want them to suffer from obesity and so on. That's why we have to do more prevention at the primary care level. But then if you do not have the data, then how can you do it? If you have the data, then you would know that for middle-aged women in a particular group, because of their diet, they might have a high blood glucose problem. So how can you achieve that objective on prevention? So if you collect the data, then it would be easier. So we hope that the Food and Health Bureau can also do something about it, because when it comes to primary care, it's not just the work of the HA, and therefore the FH Bureau will also have to collect data. And also for housing, well, they have also talked about the difficulties in applying for public rental housing. So a social worker said that for the staff that you've hired, would they be able to help explain the public housing application procedures to them? And if you don't have time, we may have to wait till the next round. Well, for the HAD, you have the support service centers. I understand that the service centers might be organized activities for EMs. It's not a problem at all. But then can you do a bit more? Can you go the extra mile so that they can cross over the language barrier, so that they can better integrate into our society? First, for food and health, can they talk to us first? Yes, Ms. Lam. Well, just now, Ms. Mack talked about primary care and also collection of data. Well, when we go back, we'll talk to the D of H and also the HA. Because when it comes to collecting data, well, where should we collect the data? At which level should we intervene? So we will have to make reference to other jurisdictions as to what they've been doing before we provide you with a written reply. All right, because of the time constraint. All right, let's extend the meeting by 15 minutes if there is no objection. Because we have two more members who would like to ask questions, and Fernando Jiang would also like to ask follow-ups. Claudia Mo. Well, I'm not exactly feeling regrettable, because I am somewhat frustrated, because we've been having meetings and we've been organizing public hearings, and something should have come out of it. But then basically the problems are very similar, and they've been there for many years. All right, during our last session, at our last public hearing, one of the speakers, Philip Khan, said something, and then the one seated next to him also made very similar remarks. So are we going to repeat that again? And then 10 years down the road, we might have another public hearing where the speakers would be telling us basically the same stories. So all in all, there is a lack of sensitivity on all these. But then I think the biggest problem that we can all see is language barrier. From day one, from the very first session up till now, we've been told that there have been language barriers. But what about the bureaus responsible for this policy? That is the CMA Bureau. They have never been here with us. They have never attended any of these public hearings. Since the first session, we had the EOC, which wrote in saying that the government should have a coordinating body for interpretation services instead of forcing the HA to have an on-site interpreter. there is no idea as to, they have no idea as to who's a professional interpreter because they're responsible for healthcare services. But then all of a sudden you're asking them to do education. But what about the housing department, the home affairs department, and other departments? So can there be a bureau responsible for that? For example, for the HA, how many interpreters do they need? And then for housing department, how many interpreters do they need? And then for HAD, they should also provide interpretation services. That should be done at a high level. And then I personally think that that should have come under the HA bureau. So my question is, my apologies, well, for the representative from the HAB, Mr. Yam, you are the assistant director. So should it come under the HAD? Should it oversee all the interpretation services for the EMs? So if you were to coordinate everything, would that be a problem? Generally speaking, what's your impression? So can you bring it back to the bureau? I would of course be writing to them too, instead of just leaving everything to you. But can you give us your advice, Mr. Yam? Thank you, Ms. Mo, for your comments. Well, at the HAD, we are trying to integrate them into society. So we are helping them to integrate into society. And if you look at the overall policy of the administration, as Ms. Mo said, the Constitutional and Mainland Affairs Bureau has been implementing this guideline. And under the guideline, well, for public service providers, they should come up with measures to ensure that ethnic minorities would have equal access to services. I think that's the mainstream view. The EAC has also got similar view. But then you haven't answered my question at all. You're not in a position to answer that question, right? Anything that you'd like to add, Mr. Yam? Okay. In response to your request, well, we can invite the CMAB to attend a high-level meeting with us, or else they will just be sending representatives from the department to attend the meeting. Mr. Lang Kwok Hong. Thank you, Chairman. Well, today we have a Nepali speaker who tripped over, and she had to go to the hospital as a result of the accident. So did she manage to get interpretation service at the hospital? Well, the waiting time is over 3 hours right now, so it might take some time before she can get a doctor to see her. Does that mean that at the A&E department she has to wait for 3 hours? Well, we have no idea because we are here at the meeting. We don't know exactly what has happened. But this is a vivid example of what they encounter, all right? She tripped over. We all knew what happened. And then she had been sent to the hospital. And then we'd like to know exactly how long she had to wait. All right. I find this a strange phenomenon after attending such meetings. All right. You would say that for the service recipients, you'd like them to be happy. Okay. Most of the users are now not happy with the services, and then they've been repeating very much the same point. That is that there has been language barrier, and the interpretation service that they receive is simply not adequate. They do not feel that they have been taken care of. And in the budget that we are scrutinizing, under which policy heading are they getting the funding for that? Is it the Home Affairs Bureau, or is it the FHB? Which bureau is getting the funding? So who is responsible for giving you the money? Who is paying you? Do you know? Can anyone tell us? Well, often a time, Ms. Leung and Dr. Zhang would be looking over at each other, and they have no idea. All right, we have the EOC, the Equal Opportunities Commission. Obviously, the EOC is not able to do anything because even in my case involving the mandatory cutting of my hair, they were not able to do anything. So that was discrimination.
Do you feel that there should be a special organization within the government for racial equality to coordinate? Do you find this useful? Because various departments are responsible for this matter. Ms. Leung, I may be able to comment on the healthcare aspect, but for the overall aspect, it is the CMAB's ambit. Well, because it should be comprehensive, so if there is only interpretation at a point of a medical consultation, you don't know whether the EM has been given the right medications and so forth, then don't you feel that there should be a coordinating department within the administration? You rely on the UOC, which has failed to do its job. I think Mr. Leung's views has already been heard. I think we should ask, for instance, someone from the Director of Home Affairs to come and meet with us, because right now the officials are looking at one another only. Well, I hope my remarks can be put on record. Yes, please continue. I'm of the view that various departments are responsible for this is rather fragmented. And they've been reflecting the same problems regarding different services they receive. So I think there should be a coordinating department. Thank you. There are a few of Dr. Fernando Cheung's question answered, and that is a telephone booking system and resident interpreters, and also the dispensary services. If you don't mind, I'll give the floor to the administration to respond. Yes, give them some time. Anyone from the HA or HD to answer this question? Yes, Dr. Mack, please. Please speak up. Well, Mr. Lee from the HA. Regarding the telephone booking system of the general outpatient clinic of the HA, I'll go and check whether that can be done. I think it shouldn't be possible. I'll see what is involved, and I will study with my colleagues to see whether other than Chinese and English, some more commonly EM languages can be included first. I think technically it should be feasible. Yes, please do so ASAP, because we made this point at the last time. You sounded as if you were hearing this for the first time. What about resident interpreters at hospitals? Well, we are really a healthcare organization. It's not possible for us to employ interpreters at hospitals. There is no way we can monitor whether the interpretation is accurate or not. Therefore, we are providing the service by means of a contract with a contractor who is supposed to be an expert in interpretation. Dr. Zhang, please do not deceive us. Well, in hospitals, you have police officers and staff from other departments doing that. So it has got nothing to do with whether you have to have your own staff. You just make arrangement for an interpreter to be always present. All right, you are talking about an interpreter present at hospitals at all times. Oh, all right, thank you. I got it wrong. I thought you were talking about whether it should be provided by ourselves or by contractor. That doesn't matter. All right, I'll check to see where the demand is particularly high. What about the dispensaries? Well, we don't have any restriction. If an interpreter is called to work, then his service can be available in the whole hospital. But you are really out of touch with reality. People have to wait for a few hours before they can get medication. So the interpreter wouldn't wait there for hours for the medicine to be dispensed. So will you improve the situation? Now for interpretation, for publicity, I think we have to work harder internally so that members of our staff will know how to help EMs better. And for information on medication, we'll see how the information can be put to the interpreters. Well, our deputations are very well educated. They ask about statistics such as morbidity of different diseases among EMs. They would want statistics to improve our healthcare services so as to cover both prevention and treatment. They want everything to be evidence-based. But Ms. Leung from the Health and Food Bureau told us that it was no simple task to gather these statistics. But I think the main service providers are either the HA or the DH. I hope they can have a wider horizon. And I go back to the HAD now. In the first session, Hong Kong CSS said that there are two committees for racial harmony. Another is a forum, and they haven't met for more than a year. So what is your plan? And the whole attendant of HD is the staff member, an interpreter, or just a security guard? How come it is so difficult to apply for the presence of an interpreter? And what about the Housing Estate Management Office? All right, for the forum and that committee, thank you very much for giving me an opportunity to explain. We've just met. We have a committee to foster racial harmony. They met twice in 2016. They met in January and June 2016. That's the CPRH. And for the forum, it met last time in April 2016. So the next will be due soon. For CPRH, that is the Committee to Promote Racial Harmony. We had representatives from the police to explain how they handled domestic violence and how the police could help EMs to handle cases of domestic violence. I'd like to know whether the agenda and also minutes are available on your website. Are they transparent? And if you don't mind, at the next meeting, can you give us information on the agenda and conclusions of meetings of this committee so that we can know whether they are really doing their job? HD, thank you very much. Thank you, Dr. Zhang, for your question. In our customer service center, well, the two are just receptionists. They are EMs. They're not there just to serve EMs. All applicants, when they attend our customer service center, for instance, if they don't know which counter to go to, what information they want, our receptionists will offer assistance, and they are not expected to provide interpretation service. And we have a hall manager from the HD. We understand that EMs may not understand Chinese or English, but we have national flags there. So if an EM there can point to the national flag of their country, and if they have not made prior booking for an interpreter, we will see whether there is someone available at the center to provide interpretation service at once. We make use, if not, we can make use of a webcam and also telephone to bridge the communication gap to address the difficulties faced by the EM. But if the person is there for asset vetting and flat selection, when he is invited to come, we will attach a pamphlet to the invitation letter. So he'll understand that even if he doesn't understand Chinese or English, he can call Cheer, and Cheer will tell us that two types of services are available, either simultaneous interpretation or interpretation by means of webcam. How come the number of cases is so low, just 400 odd cases per year? Mrs. Ho, do you have anything to add? If you can make a prior booking, and then there is on the site interpretation service or by webcam. Thank you. Yes, I've also got some information. For the past 5 years, I mentioned last time that there were 13 times when a webcam was used to provide interpretation or by means of simultaneous interpretation on site. And then as at end April, we have 2 more cases. Simultaneous interpretation was provided, and from August 2016 to January 2017, within that 6 months, we have some records. There were about 600 EM visitors to our customer service center. About 500 of them could use English or Chinese. About 100 of them were not conversant in Chinese or English. 10 of them were accompanied by their own relatives, and for the remaining 90 odd, they came mainly to get application forms or to submit documents. Our whole attendants were able to help. So when it comes to asset vetting and inquiries about applications, we could provide these services I just mentioned. Due to time constraints, I'm afraid we have to end the meeting today. On questions of making a prior booking for interpretation service and offer assistance at our dispensary, can you please follow up with information papers? Now, we hope that at the next meeting we can discuss poverty among the EM, and then discrimination. We will follow up where necessary. We can invite senior officials from CMAB to discuss more coordinated interpretation services for different departments. I'd like to thank the deputations for your visit, and you are welcome to give us written submissions later. Thank you very much, deputations and government representatives. Meeting adjourned.